Right. So, for those who don't know, ICDA is Indian Classical Dancers Association, an organization formed by one Mr. Gopakumar after his sudden demise in November 2021. I'm so sorry. A group of team members came together. We wanted to continue his dream, and in that, keeping the dancers united by providing them a lot of learning materials and whatever learning support that we could do by conducting sessions and inviting eminent guests. In this tradition, I'm inviting Dr. Kousalya Nathan. Very glad to have you, ma'am, here. And let me read out a little bit of introduction about her, because we need more time to hear from her than me taking much time. So just give me a minute. Let me quickly open the so the for to introduce her. Dr. Kousalya Nathan is a PhD, and she is a well-known lifestyle and anti-aging consultant. She has a broad base of national and international clientele, and she is known for her promising results, not only for weight management, but also for various complicated lifestyle disorders. I request everybody except the guest to be on mute, please. Thank you. Her unique blend of clinical experience with the research background gives her an edge over the conventional approach. Dr. Kausalya's philosophy is to treat and prevent diseases through personalized lifestyle intervention and precision nutrition. She has a work experience of 20 plus years, personalized lifestyle management, holistic health, anti aging, nutrogenomics. I'm sure we will hear more from her regarding all those things. And keeping the introduction very short, I welcome Kausalya, and I'm very proud, very honored to be a classmate of her all through the school years. So, welcome, Kausalya. Over to you.
Thank you. Thank you so much, Lavanya. It's such a pleasure to be with you because I think we both have kind of, done a lot of stage shows in schooling during our school days, where I think I remember Lavanya as a dancer. And now I'm so proud to see you kind of, taking it, even being in the US, to take this up and to kind of, inspire the next generation into this Indian classical arts. So a big congratulations to you and your team on this venture. And it's such a pleasure to kind of share the screen with you today and about this particular aspect of lifestyle for dancers. I think you've always been progressive, even as growing up, and very innovative with your ideas and thoughts. I think that's reflected here as well with the topic, which is not commonly thought of by many kind of dance schools, and think it's nice. And you thought of me, I'm honored as well. So today I thought maybe I'll take a little time to kind of, talk about, what kind of lifestyle a dancers can actually, take on, So generally, I think the initiation of the dance, like, the Chalanga Puja or whatever you call it, like where the first step of initiation to the art comes in at much younger age, just like probably you start even as young as 7, 8 girls into it, or even 9. So the much earlier, I think girls, and I think very, of course, few boys, but predominantly, Bharatanatyam and classical dance has been, a girl's forte. We can proudly say so, I think. So I think that initiation starts much younger. So I think that's the time sometimes even girls won't have even attained their, menarche, or there wouldn't have been any hormonal changes which should have started as well. So that's a very primitive forming stage where this art culturally is inculcated into the system through our traditional practices. So that's one best part. So what I'm trying to kind of insist or talk about here is, because the girls are into it from a very young age, I think the lifestyle also has to be taught along with it, because most of the time the dancers think about their lifestyle needs only if when the lifestyle issue arises, which can be 40 years or 50 years or much later, when there is an actual problem. It can be a low back pain, or there is a knee joint problem, or if there is an overweight issue, or if it's a pre-diabetic condition, or if there is anything related to a lifestyle issue which is inhibiting them being, on stage or performing. That's the time, most of them come to us asking for help, especially, in the field of dance, and of course many arts. But I think dance, that way, we see it much later. But here, I think what I want to probably share with you and, your students and the participants of this program is, we need to take care of the lifestyle of the dancers even when they are initiated into this process. So it can be 8 years, 9 years, 10 years. It's a parallel thing. It is not something which probably can come much later in life, or if need be, can come in. It's not an option that, you should have. So what kind of lifestyle that a child, young age, like from 9 years to around 15 years, if I can group them, can have, would be, first is, most by and large, they should be attended to any small injuries. So I think they are prone to injuries because it's a forming stage. They're not fully formed, though the flexibility will be very high, and there is an, the growth spurt still is happening. So there is a chance of mild aches and pain, and muscle growing pain, or there is a tenderness in some of the thigh muscles or in the joints that needs to be attended. So we would kind of, I'll tell you, probably.
Sorry.
So how it can be kind of, taken care of. So the basic thing is, to take care of their lifestyle would be, one, to keep them physically active. That's the first thing. So to let them play, don't look at dance as a form of 1 hour of exercise in a day or weekend exercise regimen. Dance is a form of art, and though it is physically very demanding and exhaustive, but don't look at it just as an exercise rhythm or exercise practice for a child. So most of them, when the parents come to me, they just tell me that, my daughter does 2 hours of, dance a week, which becomes as their exercise regimen, which comes under their exercise regimen, which I think should not be the case. Dance is a part of mind, body, physical, everything put together, thinking is what dance is all about. So I think when it comes to early stage, it's important to keep them physically active. It can be playing any form of sport or games, or anything. Just let them be swimming, or playing shuttle or golf, or any form of a sport can be part of the girls growing up lifestyle needs, because that also helps a dancer to kind of perform better, gives them different kind of flexibility, and different kind of strength which comes with each sport they get into. So that's very important, to keep them physically active. And it shouldn't be that, in such a way that dance or the is being allocated as an exercise, as a pattern in a child's week timetable or weekend timetable, to be put that way. So that's one thing. And second thing is, the most important part is about the nutrition. So the nutrition, as I think my favorite topic is always been, is child needs two different kinds of nutrition when this is inculcated. Like, if they are into dance, one is that growing up nutrition, which is the natural nutrition which we need to give the children. And the second thing is an extra demand, which probably the child might need depending on the grade or the stage in which the dancing performance goes. Because children, when they start early, they pick up very fast, and they come to a stage of, performance on stages. It can be a couple of hours, or if they're going to do the arangetram at the age of 15, which is again highly demanding performance of about 3 hours. So which needs to be gradual and consistent, and nutrition is very, very important. So when we talk about nutrition, the first thing I would like to insist is hydration. Hydrate, hydrate, hydrate. Because I think keeping them hydrated in the form of drinking water or flavored waters, or different form of juices. I call them live juices. I think the difference between live juice and the other form of juice, if it comes in a bottle, I don't consider it live. So if it's made at home, I think that's live. It can be as simple as a lemonade made at home, but that's the live juice. But the minute it's being boxed into a bottle or in wherever it's commercially made, labeled by somebody, not by us, so we actually don't know what's in it, because we are not it's not possible to know too much or go deep into understanding the ingredients and pick up each time we want to pick up a juice. So I think the best would be to have some form of a homemade juice. It can be a sweet lime or mix of fruits, or a vegetable juice, a carrot juice, or carrot celery, or whatever the child likes. You can actually prioritize it or give an option to the child to choose the combination of fruits and vegetables, so that the child is participating in her nutritional program, or in her nutritional interest, so that she enjoys what she makes, or she can actually titrate her own needs of the juices. So I think that's a very important part. There is again another question most of them ask me. Some of them say, juices are not too good, and the whole fruit is, eating a whole fruit is better than having juices. But again, there is a two views here. One is, if there is when we feel thirsty, we cannot eat. When we feel thirsty, we got to drink something, which can be, water, or water. Sweet induced waters, like fruits, or some form of juice, which I think is mandatory. So I think we can opt for whole juices. For example, you can choose, guava, or you can choose, blueberries, strawberries, where the whole fruit can go into the juice. You blend it with your own, combinations, and you drink it. You don't have to kind of, strain it. So when there is no process of straining, there's no fiber which is being thrown out from the kind of juice concept. So the idea of avoiding juice was the straining factor. But if you can make a combination without straining, why not have it as a drink if the child prefers to have it so? Because now I think sitting in one place and having a full meal, and children have so many things to do, it becomes difficult. And most kids, in my understanding, they like to have a drink. Even breakfast is becoming smoothies these days. So I think we need to find out a way where it's interesting, nutritious, yet received by the children, because otherwise we try to force something into them, like our own way of probably our own way of belief system, or our own cultural needs. I think it's going to backfire and it won't work. So I think the best way would be to respect them, to understand their likes and dislikes, to involve them in the nutritional program of theirs, and then discuss with the nutritionist or a lifestyle consultant if need be, and then make a plan where I think they enjoy it. But one thing, let me tell you here, Lavanya, I think food is to be enjoyed. Why are we all scared of eating? Why should we have so much in our mind? Growing up days, I think, I eat from your tiffin, thing, and you eat from mine, and we never calculated how much calorie you are eating, how much I think, what my mother. I enjoyed your mother's cooking, and you enjoyed digging into my box. It was as simple as that. Today, there's like everybody is following a diet. First of all, I hate the word diet. What is diet? Why is it being too kind of misused everywhere? Why should you be on a diet? Tell me, why should anybody be on a diet? Why can't it be eating well? Food is something we love, and it's part of us. I think that nobody should be on a diet. You should eat well. For eating well, I think we need to break the different myths that we all hold. One is because of the social media, or because of the different kind of, everybody is talking about nutrition. There's too many channels. There are people, different kind of diets. One day it is about keto diet. The next time you see somebody following some kind of a low calorie diet, and there's someone talking about vegan diet. And I don't have to name it. I think every day there is a diet coming. You open the WhatsApp, I'm sure you will know more than me. I don't know. I don't go into that because I don't believe in it. See, what is important is, never forget what your grandmother gave you or your mother gave you. I think that's the base. Did your mother has ever put you on a diet growing up? If not, why should you put your children on a diet? Why? So if there is a change, if you feel the child is little on the overweight side, or the child has got some lifestyle issues like a reflex issue or a thyroid issue, then consult a good physician, take proper health, so that the nutrition is to be balanced. It's not to be cut down or to be kind of deprived of. Food should never be deprived of. If you have a sweet tooth, you want to have a sweet, why not? Why not? Why can't we have a sweet? Why can't a child eat a sweet? That's fine. That's perfectly okay. We just have to educate them. Replacements are okay. For example, instead of giving them white sugar, we can replace them with jaggery, or palm sugar or coconut sugar or date sugar, which is fine. I think time to only do replacements and not to kind of completely cut them out of their choices or preferences or their likes, which I think will not sustain for a longer time. And it's not the right thing to do. I think let children enjoy food. I think we all enjoy. Let's all kind of recollect our childhood. We had such a lovely childhood that I've not even heard of the word diet. Did you, Lavanya, growing up? Have you ever really heard of somebody telling you, oh, listen, Lavanya, I'm on a diet? What's that? I think today children should kind of should eat well, tell them what to eat well. And I think for example, and how many of you here understand Tamil, I don't know, but still, we used to have this sweet made at home called adirasam, which is with jaggery and rice flour. And now rice is again a problem. Why? Why is rice a problem? Rice is the best food ever. Let me tell you why. Have you really heard of a weaning diet where chapati was given to somebody? In at least not in South India. We were not grown up. The first weaning diet at first, the 6th month was never a chapati. It was always a paripu sadam or rice with ghee, which has been mixed with some little rasam or something, or idli, or, pongal or khichdi. It was never puri. It was never paratha. It was never a fulka. Then why? I think now we don't want to, when the first food itself was given to our children, as the first bit of weaning was more rice based foods, khichdi's. Why are we right now talking about too much of why are we hating rice, and why rice has become another kind of a scary thing in your plate, and why rice is looked as one enemy? Where I eat rice, I gain weight, oh, I'll become fat, or it is fattening. What all we have kind of myths. Let me tell you, if there is to be something to be kept in your plate every day, let it be rice. I'll tell you why. Because rice is partially digested. It's easy on the tummy. Okay. If you have a tummy issue or a stomach upset, we'll always go for some kanji or a porridge or some form of a khichdi or a pongal or an idli, some form of it. Not only here, even in other kind of Indian states, and also overseas, where I think they go for mashed foods like mashed rice or mashed potatoes or mashed sweet potatoes. They're all simple carbohydrates. So I think when the stomach is not doing well, or if there is an upset, we give some partially digested food. You know why? Because it's easy. When you kind of eat it, the stomach can actually, the intestines can absorb better. The stomach can digest it. Gastrointestinal system can digest it better. I think we need to understand that. So can be anything: mint rice, lemon rice, flavored rice, or fried rice, or you want to give them some tamarind rice or curd rice, or gravies and sambar or rasam or dal. I think please go ahead, let it be a part of the child's staple thing, at least in their lunch meal. That's one. And second, and most important thing, dancers need more carbohydrates. So 60% to 70% of their plate should have carbohydrates. So in carbohydrate, there are two types. One is the simple, second is the complex. Simple is the rice, which is partially digested. If you want to go for a healthier option, you can always go for hand pound rice or brown rice, which is a much healthier option with a low glycemic load. And then have more vegetables like broccoli or Brussels sprouts, beans, sauteed vegetables, whatever the child likes to eat can be, that's also carbohydrate. So the minute we think rice is carbohydrate and fruits and vegetables, we think they are just an add-on to the plate. No, give equal importance to it. So if you have around 50-60 grams of rice, I think you need to have the equal portion of the vegetable for the children. The next important factor is the protein. For dancers, it's recommended that 15% of their food comes from protein. And growing up children might need little bit more, because I think they are in the stage of growing up. So that can be in the form of milk or yogurt, or a paneer, cottage cheese, or you can give them boiled chana, lentils, dal, any form of protein which you are used to can also be given in the lunch plate. And the most important part, it will be the fat. Don't run away from fat. There is Fat is very important for your body to stay young, and also to have the fat soluble vitamins working well in your system. And also, most importantly, is to help you grow better. There's an hormone which gets secreted with the fat. If you want to lose weight, believe me, that has to be fat in your plate. And if you want to stay healthy, stay youthful, stay fresh, I think that mobility of your body to have good, agility, we need fat. Again, let's understand fat. Fat, we know good fat, bad fat. Yes, that's a fact. There is a good fat and a bad fat. What are the bad fats? It's all like saturated, like for example, reusage of oils and too much of deep fried items. So those all can be limited. For children, don't say no, it can be limited. Or you can make it at home. You can make your own French fries at home, where there's no reusage of oil. Once a week, we can make the same, try to make it at home, or try Indian vadas, which I think are healthy. People ask me, whenever they clinic, I tell people, I can help you make a plan where you have the pidi korakate, which we all like, and the vade, masala vade, to lose weight. Would you believe it? You can eat korakate, which is rice and jaggery, which is such a fantastic kind of a snack. And vada, who doesn't like vada? I mean, we all love vada. And if it's masala vada, you can add, plantain flour, or you can add drumstick leaf, or you can add some vegetable to the masala vada and have a lovely vada. And why not? I think, Mike, why should we kind of, run away from such wonderful delicacies and stick on to some fancy, quinoa salad? And, nobody likes to eat a salad. Let's admit it. I don't want to be promoting salad here, because I don't like eating my full plate full of salad. No, I need my little bit of salt and my spice, and my mita, that little sweetness. I think that's what completes us. Because if I have a bowl of salad, I love salads, I'm not saying no, but I can't have only salad as a snack, or only salad as a particular meal. Have it. So this vada, for example, break down the vada. What does it have? It's an dal, which is protein. We all know, and I'm sure it's all in our science books. I don't think you need me here talking about dal and protein. We all know that dal has protein. Fine. So adding some vegetables to it, some little bit of carbohydrates coming into it, and you're going to deep fry it. Yes, you're going to deep fry it. And then once the deep fry happens, there is also fat going in. Isn't it a complete meal? And why do we say no? The limitation only matters. Like, for example, you have 2 or 3 vadas, which is fine, but don't overeat or don't overindulge. So the emotional eating, or eating just because I'm bored, or just because somebody has kept a plate full of vada in front of me, that's where the overeating or the problem has to be addressed. Or we need to have a mindful eating with vada. So you've got to meditate with vada. Then I think you'll enjoy the vada, and also you'll get the nutrients which comes with vada. So I think we need to understand that, it's not that, the Indian dumplings, so we call it korakate, where there is a wonderful filling of, a coconut and jaggery filling inside. We call it tenga purnam, and then you have fill it with that dal, filling comes with the korakate. It's a rice steamed food. There's no oil in it, and children love it. And it's such a delicacy that, which probably is so healthy and can be had. So I think we need to help children relate to healthy food, help them to connect with food, help them to love, I think their plates. I think it's time to help them to kind of, love nutrition and love food. That's very important, the right way. So I think that's again important to take care of. So I think when you balance a plate, as I described now, keep it 60 to 70% of carbohydrate. And if there is a performance, if your child is performing, you need to step up the carbohydrate and bring down the protein that day, because a little bit of an extra carbohydrate in the form of a fruit or a fruit juice or a whole fruit juice can definitely give that boost of an energy to the child. Because when they perform on stage, it's all high intensity performances, high demanding, and there is there's going to be excess sweating, and energy you need to kind of perform on stage is very high. So we need to kind of help the children have dates juice. My option to you would be dates juice. Just soak 10 to 15 dates, de-seed it, remove the seeds, just blend it with some elaichi if your child likes, or a vanilla essence if your child likes, or a little bit of coconut milk if you like, or an almond milk. That's about it. With some ice cubes, you can actually serve it. It's very nice, and I think you should try it. So before going on stage, you can actually give them a nice dates juice. It's light on the stomach as well. It doesn't give that heaviness or a bloating or a kind of an heavy feel as well. So I think that's one option which definitely you can think of. So that's one. And again, the next important part about apart from the nutrition would be about rest. I think a good quality of sleep and having a good rest is again an important part, in children, while the growing up stage matters. So that's an important part of it. And as I mentioned initially, assessments, there are two types: self-assessment and also assessment with your teacher or your guru, or with your a physician if need be. Is self-assessment is the time between your rest and recovery. Whether are you able to completely recover from the practice that you'd have had the previous day. Are you able to be completely okay the next day with full energy and full ready to take on the whole day, is very important. If the recovery is slowing down or the recovery is less, we need to really kind of bring it up to your gurus or your mentors or your teachers, need to discuss, and then streamline your sleep and resting phase, and then have your balanced kind of day, which is also very important. I think overall that's what I think I would probably give it to the children. But overall, when it comes to dancers per se, like all there's a lot of very senior experienced dancers as well. So I think I like to briefly tell you a few things is in the form of dance itself. I thought I like take lifestyle through dance. So DANCE, let's understand, it's easy to remember as well. The D is for don't ignore injuries. That's the first thing. If you need to give an ice pack, it's very important to give an ice pack. If you have some injuries, you need to take it easy. You need to relax. If the pain persists for more than 24 hours, you definitely have to see a physician or an orthopedic surgeon or a physiotherapist to kind of make sure that the injury is healed faster. That's the first thing which I would like to mention on the dance part. The second, the A stands, as I said, for assessment. Two types of assessment. One is a self-assessment about your recovery and rest and recovery, and this next assessment is about the medical assessment. So at least yearly once, it's good to see a doctor or a physician. Get your parameters like your pre-diabetic condition or your height, your weight, your anthropometric measurements, and then about your any lifestyle disorders like hypertension, measuring your blood pressure, measuring your vitamin D levels, your calcium levels, your B complex levels. All that can be assessed, and then proper nutrition, lifestyle changes, and supplements will really help in taking care of the lifestyle requirement. Then the N stands for the nutrition and the nutraceuticals. As I discussed elaborately about the nutrition for children, for adults also, the nutrition plays an important role. And I think for adults, it'll be very simple. I think I'll put in a simple terms, is like 40% of your plate. If you have a 6-inch plate, which is a standard plate, I think keep it around 30 to 40% of your plate. Keep it carbohydrate. It can be your favorite rice, or you want to have full carbs, or you want to have any form of a small grain that you want to have as a carbohydrate. Let it be that. And then keep around 40% of it to a good source of vegetables, like a lot of vegetables, equal portion of rice and vegetable. And then in that remaining 20% of it can be protein, which can be in the form of dal, or if you like eggs, you can have eggs, or you want to have paneer, or you want to have a moong dal, sprouted moong dal, kind of a chaat or a salad, or you want to make patties and all, you can try it. So this by and large can be a simple, a dancer's plate, which can be easily followed along with the rest of the stuff. And nutraceutical, yes, I think is very important for supplements also, like calcium, vitamin D, and ashwagandha, which also helps in muscle relaxation, and also some kind of form of an, herbal stuffs like milk thistle, all that cohort and all helps in relaxation of the muscles, so that there's no aches or pain when you kind of dance or give prolonged performances. Then the C stands for conscious eating, where I think hydration, hydrate, that's very important. And also about mindfulness when you eat, as I explained, meditate with masala vada. That's what would be my tagline for today, would be meditate with your masala vada, where you keep your mindfulness and enjoy the vada. Vadas are not harmful. And one more thing about vada, let me tell you, is when the oil has to be really heated up, right? So it has to be the boiling point when you dip the vada and take it out. So when the oil is really heated up to a higher level, I think when you kind of do a deep fry, it will not take too much of oil. So that's the trick. See, potato fry will have more oil than the vada. So vada, when you deep fry it, it will not have as much of oil as other, for example, like as I mentioned, any French fry or something which has a deeper, deep frying thing. So I think that is also something where minimal oil is good. So take care of mindful eating. And the next about the E stands for exercise and dance. So exercise, again, two types of exercises are important. One is the breathing exercises. The next is the physical form of exercise. So breathing exercises is very important, where you actually create a strength to your lungs, because when you dance, you go breathless. There is a lung kind of a function, which is, heightened lung function is happening. So it's very important to take care of the exercise bit. That's the first thing. Breathing exercises like, pranayama, or some form of an regulation, breathing dynamics, which can actually help. And then the other form of exercise can be being physically active. It can be walking, it can be playing any form of sport, or if you are a gym person, you can definitely, under guidance, can take a gym training, So that's the thing. And most importantly, before you start performing, it's so important in the exercise form to have your warm up exercises. And also, once you finish dancing, it's important to have a cooling down form of an exercise. This is also very important for dancers to make sure that, their kind of body and the circulation is taken care in the right way. So I think this is what I think, in summing up, I would like to, in the form of the lifestyle through dance, like, where the DA and CE can be taken into the different lifestyle zones, so that it's easy for us to remember. And probably some of you can try practicing it and let us know how it has helped you. And thank you so much, Lavanya, for this opportunity. And if there are any questions, I'd be very happy to kind of take it.
Sure. Thank you so much. Like the most welcoming things where you can have vada, you can have, like, but it's with a limited quantity. That's the caveat there. But then, need not abstain and be afraid of looking at food only. That happens many times when we are on, like, am I okay. Let me ask you the first question. Let me remove spotlight, and so that I have to and get into a view of gallery. And all right. So my first question for you is that we, as you rightly pointed out, we start dancing early, and at that time we are simply not bothered about our food intake. But as we grow older, the activity for many of us, due to various like reasons, comes down. That physical activity comes down, but I've always heard that dancers put on a lot of weight after a certain age. Is that true, or is it a myth?
Okay, so I think it is definitely a myth. Okay, there is nothing related to dancing and gaining weight. But I'll tell you why there is a possibility of, dancers gaining weight is one day you stop dancing. Okay, you get married or there is a child, a family, and then, your priorities change, your career take on. So one day you stop dancing, but your food intake is going up. So obviously, it's not the physical activity or what you are used to your body to abruptly stop, whereas the food continues or it's given more. So obviously there's going to be a mismatch in the ratio where you will be gaining weight, right? So I think that's one thing that we have to understand. The minute you think you are kind of not able to dance or you're kind of taking a sabbatical from dance, you need to replace that activity through some form of a physical activity, one. And maintaining a good lifestyle irrespective of, whether you are an active dancer or you are a teacher or you are a coach. It's important to take care of that as well. So I think it's not that, you're a dancer and you gained weight. It's because you stop dancing and you kind of continue to overeat, or if there is a not a regulation, that's the time the overweight happens.
So I open the flow for questions from audience, and I'd like to read some of the questions I received from the chat. Dr. Surabhi, would you like to ask the question, or would you want me to read it?
You can read it, ma'am, please.
Sure, ma'am. Being a dancer, rice is good for diabetic people also, ma'am, is the question. Is it good for diabetes? People with diabetes.
Okay. So, yes, I think rice is not definitely good for diabetics also, but you need to replace white rice or refined rice with unpolished rice or hand pound rice. And you need to, depending on your diabetic HbA1c level or your diabetic levels, you need to understand how much portion of rice you can have. That's very important. So I think when there is already a diabetic status or you are a diabetic, meaning your body is not able to metabolize carbohydrate. That's what diabetes are. So when you already have an issue with the carbohydrate metabolism, you need to check with your doctor or a physician or a nutritionist or a lifestyle consultant to know how much of rice is appropriate for you to balance your diabetic level. But having said this, diabetics, they can include rice in their diet.
So the next
One more doubt, ma'am. Shall I continue?
yeah, please,
Ma'am?
please.
Yeah. During the menopause, is there any possibility dancer can get that diabetic, pre-diabetic symptoms?
Okay, thank you so much for the question. See, irrespective of whether we are a diabetic or not, menopause itself can actually, when the estrogen level dips and your follicle stimulating hormone goes up, there is definitely a tendency of, pre-diabetic, especially with Indian ethnicities or Asian ethnicity, So if you have the Indian genetic makeup and, you are in the menopausal stage, there is definitely a chance, of a pre-diabetic condition to set in. But just because I think you're a dancer and you are under menopause, dance has nothing to do with menopause.
Okay, ma'am. How to overcome this problem?
You mean, sorry, the pre-diabetic
Yes,
condition?
ma'am. Pre-diabetic
Okay.
symptom
See,
condition.
there
I'm
are the
getting
causes of the.
oversweat.
Okay. How old are you, ma'am?
I'm 45 years.
Okay. So if you're 45, we need to first assess you. There are three stages. One is the pre-diabetic condition, pre-menopausal condition, or menopausal, or post-menopausal. There are three stages to it. So with your age, I assume you must be in the pre-menopausal age,
Yes,
where the menopause
right.
is probably not fully set in, but it is in that stage where there is an initiation or a starting of the menopause. That's called the pre-menopausal stage. In the pre-menopausal stage, the best is to take care of your nutrition seriously. I think we need to work on replacing all refined foods with the whole foods. For example, instead of having maida or refined flour, you can replace it with the whole or hand ground wheat flour. And if it is white rice, you can replace it with brown rice or hand pound rice. And if you're having some form of a millets, you can actually have it as a whole form, in the form of dosa or in the form of a grain or a khichdi or something. And you can have more of low glycemic index fruits like guavas, kiwis, peaches, plums, and pomegranate. You can avoid mangoes, sapotas, and bananas and papaya because they are high on glycemic load. And exercise, physical activity is very, very important, because when you're in the 45 and the menopause is setting in, your metabolism slows down. When the metabolism slows
Okay.
down, to keep up your metabolism well, at least 45 minutes of a regular physical exercise or a yoga will really help you to kind of prevent diabetes, and also overcome menopause in a much graceful manner.
Okay, ma'am. Thank you so much for your kind advice.
Thank you.
So going on to the next question. This is, I don't have the name. It's given as iPhone. But I'd like to read the question. Ma'am, what food we will take before warm up or exercise?
Oh, that's a good question. Yeah. See, I think if when it comes to before warming up, I think for the dancers, the kind of food that you should have should be in the form of seeds or nuts. If you like to eat, you can have this melon seeds, pumpkin seeds, sunflower seeds, flax seeds, all this like you get in the form of millet and multigrain and multi nut and multi seed, in the form of balls, or you get it in the form of bars as well, which is available. You can have that with two figs and two dates, which will not overstuff you, same time give you the enough energy to kind of go through the warm up and dance practice. And during the dance, it's good to have an electrolyte drink. For example, it's not the synthetic art electric or electrolyte drink what you get in the market. You make your own drink. For example, you can have musambi juice, that's like a sweet lime with jaggery, elaichi, and just a dash of ginger. I think it's that old panagam kind of a taste, but instead of lemon, you use sweet lime. So sweet lime definitely adds a little bit more flavor and strength to the for energy during the dance. So you can replace, instead of lemon, you can have sweet lime to be used there, or tender coconut water if you get it. Or you can make pomegranate lemonade with pomegranate honey and then lemon in it. So that also, and pinch of salt like Himalayan pink salt will help you in kind of having that recuperation faster during the dance. And post I think dance or the cooling down time has to be more of just plain water. So I think it's good to have just plain water, because we got to hydrate your body. You need to really kind of bounce back faster. So the cooling down time can be more of water, and after half an hour you can actually have a soup or a salad or any fruits, or it's a dinner time or your lunchtime, you can go to the meal after that. So I think if you balance it this way, this might give you a better result.
Uh, the person who has asked this question, do you have any follow-up question? Okay, so I move on to the next question. This is from Lata. Lata ma'am, would you like to ask the question or do you want me to read it out?
I could ask, good evening, I'm Lata, and some of my students complain of knee pain in one particular spot. The spot varies for each of them though, but it's excruciating pain, and they are not able to dance for many days together. That is one point. And another one I want to ask is personal. It's about bloating, because through the day there is a lot of bloating. So I want to know if you can help me in both these aspects.
So,
Okay.
did you hear the questions clearly or do you want me to?
Yeah, I think it was not fully clear. Can you
No
please
problem.
repeat it for
Sure,
me?
sure. Sure. The first question is about her students complaining about excruciating knee pain and they are not able to
Oh,
dance for many days. So once you
okay.
answer that question, I'll go over the next question because that's
Okay,
my
sure.
favorite
So,
question too.
okay, okay. See, the causes of the knee pain is probably they have a postural issue. Okay, that's one thing. And second thing is the under the supervision of a guru or the teachers, when they dance, I think you correct them and you kind of, tell them about the posture and everything. But they tend to kind of, because my niece is a dancer. Okay, so I've seen her whenever she's home, she'll be kind of walking on aramandi, she'll be dancing here, she'll be dancing. So that time the posture changes, and she'll be kind of, climbing the stairs, and then suddenly she would want to do some dance. So they are the children are very enthusiastic about the dance, and so when they start implementing the dance postures and want to try dance on their own, without the supervision of the teachers to be corrected at home, that's the time this kind of injuries do occur. So initially, if children are complaining of knee pain, tell them not to practice anything at home to start with. Let them do it only with you. One. And third is, check on the sleep quality of the child, because if the child is not rested and recuperated well, I think the next day there is a muscle soreness and there is a stiffness in the muscle that can also cause this kind of a knee pain. And the third is there's something called recurrent stress injury. So if they kind of repeatedly keep doing the same thing, probably inside there has been a small injury which would have happened, which has been left unattended to, and over a period when the same thing is repeated, they might have kind of have a pain which is excruciating or prolonged. So the best would be to ice pack, and as I told you, the first thing for the dancers, as the D stands for, don't ignore injuries. So I think if there is an injury, if that means pain means injury, if there is a pain, especially in the knee or the hip, there has been, especially for growing children, so there can be some injury which has been unattended to. So I think request the parents, or you can also guide them with your experience to attend to the injury first. So I think that way you can take care of the knee pain. And the next question is,
Is about how to prevent bloating, which she is
oh,
asking
okay,
on a personal level.
okay, nice. Okay. So I think bloating is a very kind of a common problem which we see. And the causes for it is, one is mainly your gut flora is not healthy. There is a good bacteria and the bad bacteria, right? So good bacteria on the skin and bad bacteria on the skin. Good bacteria on the oral, the mouth has a good and a bad bacteria. The skin has good, bad bacteria. The intestines, stomach also have good and the bad bacteria. So when it comes to the bad bacteria which is high on the stomach, the gut flora is an imbalanced gut flora. So the bad bacteria is high and the good bacteria load, which is very important in digesting very complicated foods or difficult foods, is less. That's the time the food stays in your stomach for longer, making it ferment, and then making that bloating feeling in the stomach to kind of happen. So I think so with what I think she's mentioned, I understand it's about the stomach bloating and it's not about the water retention, right? So I think stomach bloating, basically this, the solution is, one, try to remove few foods from your diet, like for example refined flour from bakery items like bread and biscuits and cookies, which are all basically made with refined flour, then sugar, and then butter, and then most important, the yeast to kind of bloom the flour up. So I think these are the things which are for a stomach. So try to avoid bakery items. One, eat on time, chew your food well and have, and please fall in love with your rice. If you have been off rice, just go back to it. It's going to really heal your stomach because it's so light on the stomach. That's important. And drink ajwain water. I think that ajwain water is like that omum, where you kind of 300 ml of water, 1 or 2 pinch of the omum, bring it to boil, switch it off, let it settle down. You can actually strain it and then drink it warm. So this really helps in the bloating, whereas you take the load off your gut so that the gut can produce its own good bacteria and then settle down faster and better.
Lata ma'am, do you have any follow-up question?
No, thank you so much. Thank you.
Sure. So the next question is from Sheetal. Sheetal ma'am, would you like to ask your question?
Good evening, ma'am. Thank you. Ma'am, I would request you if you can just read my question on my behalf.
Sure,
Thank you.
sure, I'll do that. So I'm leaving all the good things for the last. So, and the question is, how should we deal with back pain, especially lower back? It creates a lot of problem for posture, like in Aramandi or Mandi.
Yeah, true. Because I think um, I can relate to it, because growing up days, I think, of course, Lavanya has continued her dancing. She was always, I can actually relate, but we both, I was also I've learned Bharatanatyam for nearly 8 years, and during that phase of my learning, I have also experienced a bit of a back pain. See, back pain happens for two, three reasons. One is the back lower muscles are not strong. So first is the warming up exercise should always have some form of a back strengthening exercises in the form of yoga, or in the form of, where you stretch your, muscles or twist it on different sides to give them that little strength. So back strengthening exercises is very important. When we talk about back strengthening, sometimes if your abdomen muscles are weak, the back muscle will become a compensatory muscle to take care of your posture. So it's very important to take care or strengthen your abdominal muscles as well. So I think when you really do the exercises to kind of relax your lower back muscle and strengthen it, parallelly, we got to work with your abdomen muscles as well. Most of the time, maybe after pregnancy or after a particular age, there is a laxity in the abdomen muscles. So we need to strengthen it so that, you can prevent the lower back pain. And hot water packs, and also sleep posture, and then the kind of, footwear that you use, if you're kind of wearing high heels, or, heel that you use for a long time, or if your job calls for a prolonged standing, all that needs to be kind of, history need to be taken, and we need to help them accordingly, so that, this back pain is forever taken relief for.
Is this back pain having any connection with, suppose, we give birth to a child and it was a cesarean or anything of that sort? Will it add?
See, actually, not really. It shouldn't. If at all you have had a proper, cesarean, birth, childbirth, it actually shouldn't. But some of them, if they had any spinal anesthesia, some of them, can have a spinal anesthesia during a cesarean. They do complain of a lower back pain. But the best form would be to keep yourself active, get to yoga and postures and back strengthening exercises, and make sure the mattress or the cot in which you sleep is good, it's the right one for your back. And don't kind of try to couch into a chair or a sofa while watching TV, or while you're sitting for prolonged hours, because that's the time where you're putting too much of pressure on your back, and then that can also cause stiffness in your lower back. So if you can be a little cautious and mindful, and give some awareness to your postures on a daily routine, then definitely you can actually get rid of the low back pain.
So there is one more question from Dr. Surabhi Lakshmi. I'd like to read it for you. So Dr. Surabhi, Kausalya Nathan comes more from a nutrition. So if you have any nutrition related question, that would be great. But still, I'd like to read the question. I am suffering from ligament tearing during dancing. How many months should we be in rest? And when we should start practicing dance?
Okay. See, ligament tear usually happens with the wear and tear. Okay. The ligament tear is a prolonged, unattended injury, which can cause a tear over a period of time. For this, you need to definitely see your orthopedic surgeon, get it evaluated, the degree of the tear, whether a first degree tear or a second degree tear or a third degree tear. It depends on, the strength of the muscle around it. If it's at the ankle, or if it's the hip, or depending on the area of where the ligament tear is, it's important to
It's
assess
knee,
the
ma'am.
grading of it.
It's knee.
Knee,
There are
okay,
two
knee, okay, yeah,
tearings
knees are
near the knees, around the knees. Always dancers are suffering with the same, like
correct,
number
correct,
of
correct.
times. Then sprains are going to be happen when we are doing
True.
dance on
Yeah,
stage, and sometimes
correct.
ligament tearing and continuous dancing. And whenever during the practice, it won't happen. Sometimes on stage, if we are very emotional, no, we'll do more and more bendings and all,
Yeah,
na, on stage.
correct,
So
correct, true.
that time, yeah, during the
Yeah,
Tirupati program, I suffered with that. And from that period of time, there are so many, after resting my body, after suffering this ligament tearing, and I'm pre-diabetic and menopausal and irregular periods, and everything was happened. Till I enjoyed my life with dance, no, there is no formological problems, like no physical problems for me. And then afterwards, when I going into the rest, due to this reason, I started struggle a lot. So that's why I came to know about yourself, and immediately I want to talk with you. And
that's
in front
nice.
of
Thank
you,
you
there
so
are so
much.
many problems. Thank you so much, ma'am. Yeah, tell me, ma'am,
Thank you.
what should I do right
Yeah,
now?
see, I think you need to consult a physician. You need to consult
Okay,
a lifestyle
I took
consultant,
MRI
or
also.
yeah. So you need to
I
have a
took
complete
MRI.
thorough assessment, so that I think
Okay.
the bone health, the nutritional status of your deficiencies, and also about your posture, and then the rate, the
Okay.
pre-diabetic, what is that stage of your pre-diabetic, and if you're
Okay.
post-menopausal, what are the symptoms you have. So you seem to have the different kind of a lifestyle combination related to aging and to dance and genetic factors and stuff. So
Yes,
there's a
yes.
combination of lifestyle issues. So you definitely would require a good physician or a consultant to consult with, so that there is a personalized plan for you, which is customized to your issues, to address it in such a way that you can reverse your pre-diabetic, you can reverse your if there is a menopausal issue, you can actually take care of it in a healthier pattern, and the nutrition, the lifestyle, the exercise, and then strengthening exercises, toning exercises, sleep, and all that which is involving the lifestyle personalization will help you get better.
Yeah. Thank you so much, ma'am.
I'd
Yeah.
like to add, ma'am, at the end of the session, we would be sharing Kausalya Nathan's details, her website, and so that, if you want to further go into personalized consultation, you may choose.
Yeah.
So that would
Yeah,
be,
definitely.
she may have to work with you a little bit more to understand and personalize things for you. Moving on
Yeah.
to the next question, it is like from Saurami. Saurami, would you like to read it? Okay. Saurami, fine. So she says, ma'am, after COVID, I got very weak. Even after 5 months, not able to dance with full energy. I do take almonds every morning and have normal diet as rice and vegetables. Do I need to add anything else in my plate?
Okay. See, I'm sorry you went through a COVID kind of an patch, and then you're a post-COVID recovering phase. I think COVID has definitely has known and unknown post-COVID symptoms that we still continue to see. So one of the things which we see is fatigue, which has been very common. With some of them, they recover within 6 months, the post-COVID in 6 months. Some of them, they do take more than a year to kind of get back to their stuff. So I think don't worry. I think it's just the phase where you're going through that low energy or a fatigue, but it'll kind of come back within at least 6 to 10 months time. When it comes to your plate and your nutrition, I would definitely recommend you to have some form of a smoothie in the morning at 11 o'clock with nuts, with coconut milk, with nuts, and figs, fruits, all mixed together. We call it as I told you, as a live smoothie or a whole live smoothie. It's not been kind of You don't filter it, or we don't kind of strain it. It's a whole smoothie. You can actually refer to our Insta page, which is Dr. Kousalya Nathan's KALM. KALM is my company's name, which is Dr. Kousalya Nathan's Anti-Aging Lifestyle and Medicine. So here, if you go into the Insta page, there's an everyday juice or a smoothie which is being posted. It's a 3 ingredient simple smoothie which can be made with the home ingredients for a healthier, or for immunity, and for nourishment, and it's a whole life juice. It's a simple and easy to make. So one of such juices combination, I would definitely recommend you to have 300 ml a day at 11 o'clock every morning. And then in your plate, please do add probably a whole egg, or if you're a vegetarian, a bowl of dal, or a dal palak, or boiled chana, or chana in the form of sundal, or in the form of a salad, or mixed sprout salad, something you can definitely add in your plate, with apart from what you had mentioned. And evening 4, it's very important to address if you had any form of cravings, or there's some requirement of some food, because tiredness does set in. So vegetable cutlet is one option which you can actually opt for, which can be shallow fried in the tawa, which can be made. Or you can have idli upama, or dosa, vegetable uttappam, or whole bone dosa. So some form of that at around 4 o'clock. Why I'm mentioning it 4 is the time where the cortisol level goes up, the stress hormone goes up. So that's the time the craving is there. You want to eat what all is there in the refrigerator, or you think of food way too much, and then there is a need to kind of munch, or you just feel I feel like eating the whole world kind of a feeling sets in. So that's because your cortisol level is going up that time. So before it goes up, feed it with something nice, like a chaat, a corn chaat, or a sweet potato, boiled sweet potato, or it can be, as I mentioned, cutlet, or a vada, or a pidi kolkata, or a idli, or a thin one dosa, or a vegetable dosa, or a masala dosa, one masala dosa with lots of vegetables in it, something. So which can be had at 3:30 to 4, before your body gives you some vague alarms and disturbs your mind. I think address it with grace, the craving, so that it really helps you to prevent any form of stress, or stress eating, or emotional eating, or a craving, or lowering the energy. So I think to immune boost, I would definitely recommend the juice or the smoothie, and an evening snack at 4 for you.
So I have one more question. I find that most of the children who come and join dance class, they are overweight, and most of the joints don't work. Like many, the wrist also doesn't work. So it's like it's as if the joint doesn't exist. They can only keep like this. So the first question the parents ask me is, should we get them into any diet? So is there any simple tip that I can suggest? Because it's not a one size fit all, right?
Right. See, the thing is, you should just kind of ask them to uh, replace refined carbohydrates with, complex carbohydrate. That's one thing you can straight away do it. Where, you have more of fruits, more colorful vegetables, or like, as I told you, the live smoothies, or a live juice, and, reduce the kind of the roti, or the, if there is any pasta, or a pizza, or something the child is eating. So I think we need to balance it out. In fact, you can talk to the parents and talk to the child, figure out a way to kind of help that one. And second thing is, I think you need to also measure it with the height as they grow. The growing spurt does happen, and we generally don't advise weight loss in children. Below 15, we generally, for girls, weight loss is not advisable, because there is a growth spurt. So that if the height, at some point, if the weight stops, the height takes over, the weight will balance it out. So we don't have to put them on any particular weight loss regimen or anything, but being watchful, and being kind of being more aware of what we give our children, and how to take care of them, the nutritional requirement is important.
Just an add-on question to it. Many have their dinner and immediately fall asleep. So can that be like requested? What would be the ideal time when we should have our dinner and go to sleep?
Yeah, I think first is for children, especially the dinner time should be set. It can be 10 p.m. should be a cutout time. So after 10, there's no lights around, meaning the lights from the phone or lights from coming from the laptop or any technical related instruments, where digitally you need to shut. First digitally shut, then only the mind will shut. Actually, now that's the trend. Until you shut the digital feeds which comes, you cannot mentally shut. Then mean each time there is a ting coming in, there is a note coming in, I think you really want to know who's it and what's about. I think that's nothing wrong. That's how we have been conditioned. So I think first tell the parents or request or talk to your students and tell them that I think the timeout should be at 10 and it's done. So everything off at 10, and there should be a sleep pattern to be followed, timing to be followed for your biological clock to work for rest and rejuvenation and recovery, especially for dancers. So that needs to be informed and taken care of and to be implemented by the parents and the children to have a better recovery for the thing. And your question on whether how immediately can we fall asleep after, or when to go to bed after dinner, is at least 1.5 hours a gap should be good. At least if the dinner is at 8:30, then I think 10 should be fine. Or if it's at 8, again 10. So 1.5 to 2 hours of a gap between dinner and bedtime would be ideal. And if they feel hungry at bedtime, then a fruit like an apple or a warm water or a guava or some peach, one peach or plum, some fruit, a small fruit, a banana can be actually added on.
So we are coming to an end of the session. Does anybody have any final questions to ask? Okay, I take silence for a no. Thank you so much, Kousalya. It's been a pleasure listening to you. It's wonderful following you on Instagram. And like, how do I share? Do I share any material in like? Do you have any slide or anything to share about your organization?
So I can actually send it to you on WhatsApp, and if
Sure.
there are anybody who wants any further help, can feel free to kind of refer your name and then contact me directly, because I'll give my personal mobile number, and they can feel free to message me or contact me. And this posting of this Insta juices has been going on. I think it's now 30 days, 35 days that we have been doing. So we have made something. Yesterday was tulsi buttermilk. We call it sacred buttermilk, which came out really well for the immunity, because there was someone in our session today wanted to know about the post-COVID stuff. So I know it might be difficult for you to get tulsi, but you get tulsi powder these days in the market. So instead of the tulsi, you can use. So there are a lot of options available there. So if you're interested, I think we would love to have you as KALM followers.
Definitely. Definitely. So, with that being said, we have a lot of thank you notes, and I am so happy chat box is filled with that. Thank you so much once again, Kausalya. It's been a pleasure listening to you, and thank you, participants. Please do follow her and her Instagram handle. If you don't remember anything, at least KALM. Sorry, the CALM that we want to can be, the C can be replaced with K, and then we go ahead and search for her in the Instagram handles and then start following. So with that, I thank Kausalya, and I thank all the participants, and I'm going to end the session. Thank you so much.
Thank you,
Thank
Lavanya
you,
ma'am.
Lavanya. It
Thank you,
was
ma'am.
wonderful being with you.
Thank you.
Thanks. Bye.
Bye.